The utilization of guided surgery allows, from a doctor perspective, for precise placement of implants, which subsequently allows for placement of appropriately designed prosthesis. That minimizes surgical time, which improves and enhances patient outcome. And that guide is developed by utilizing imaging technology, which gives us the information that we need to look at images in 3 dimensions on a computer and to place the implants in the appropriate positions. That information is transferred to a guide, which is a plastic guide, which is then utilized in the mouth at the time of surgery to place those implants where they should be placed based on the preoperative planning. The benefit of guided surgery from a patient perspective is that you will have placement of a prosthesis at the time of surgery that is completely functional and aesthetic due to the planning that occurred beforehand.